This in from the Minnesota Nurses Association. Quote, thousands of nurses with the Minnesota Nurses Association held informational pickets at 11 Twin Cities hospitals on Wednesday as 15,000 nurses in the Twin Cities and Twin Ports seek new contracts, which will put patients and workers before profits in Minnesota hospitals. Nurses have been bargaining with hospital executives for new contracts since March, and current contracts for nurses in the Twin Cities expired on May 31st. Quote, our healthcare system is in critical condition. Hospital executives with million-dollar salaries have created a staffing and retention crisis, which is pushing nurses away from the bedside, said Mary Turner, RN, president of the Minnesota Nurses Association. The future of our healthcare system depends on the choices we make now. Nurses are ready to fight and win for our patients and our practice. I hope the public will stand with us in our fight to put patients before profits in our hospitals. They go on to say right now nurses are overworked and hospitals are understaffed and patients are overcharged by hospital CEOs making millions. As they negotiate new contracts, nurses are seeking solutions to the crisis in our hospitals, which will put patients before profits. Along with fair compensation for sacrifices made during the pandemic and for the rising cost of living, nurses aim to solve the crisis of understaffing and retention, to better prepare for the next pandemic, and to prioritize diversity and inclusion within Minnesota healthcare systems. Here's a recent digital ad promoting their cause.
Minnesota is facing a healthcare crisis of unprecedented proportion, and it's not COVID, it's greed. Because hospital CEOs seem more concerned with making money than making us healthy. Nurses are overworked, hospitals are understaffed, and patients are overcharged by CEOs making millions. We depend on our nurses to make sure we get the care we need. Now, it's our turn to make sure nurses get the support they deserve. Tell hospital CEOs to put patients before profits.